offered through LPL Financial, member FINRA SIPC. Investment advice offered through Private Advisor Group, a registered investment advisor. Private Advisor Group and JBL Financial Services, Inc. are separate entities from LPL Financial.
Now, here are your retirement coaches, Jeff and Erin Lapidus.
Well, hello, St. Louis, and welcome to Straight Talk on Retirement. You're live and local, St. Louis's favorite financial call-in show. I'm Jeff Lapidus, president of JBL Financial Services. Our offices are located in beautiful, sunny, warming downtown Clayton, Missouri. I am a 35-plus year veteran of the financial services area, a fee-based financial planner and investment advisor, representative. And I'm joined this week and every single week by my favorite, oldest, smiling, prodigal daughter.
Smiling.
Still smiling.
That's right.
Erin Lapidus.
And I run the health insurance side of our practice. We help our clients make smart choices about their money. The way we do that is by designing a game plan, a written step-by-step strategy, a real game plan that has several goals in mind.
First is to preserve, protect, and prudently grow the assets our clients have taken their entire lifetimes to accumulate. Second is to deliver a reliable stream of income, one that they can count on, so they can do all the things they want to do during retirement.
Third is cost-effectively addressing their healthcare needs, like helping individuals enroll in Medicare and choosing the right plan to supplement their coverage.
And then when they're done enjoying their assets during their lifetime, we show them how to pass it on to the people they love, whether it's their spouses or children, grandchildren, churches, or charities, whoever it might be, with Uncle Sam or the tax courts taking a big bite out of their money. And as their financial planners and investment advisors, wealth managers, Erin and I watch their money every single day to make sure that they're staying on track. And that's why they call us the retirement coaches. Good morning, Erin.
Good morning.
Are we live yet?
We are live.
Woo!
Streaming live.
We're streaming live on Facebook.
On Facebook.
So we know.
Tune in.
Tune in. We'd love to get to see us.
We'd love for you to get to see. It's going to be great.
It's going to be fun this morning.
Yes.
And as a reminder for everybody, Erin and I do offer a free monthly newsletter. We call it the Coach's Corner. Erin, how do you get it?
Well, log on to our website, JBL Financial. Click on the pop-up box that appears on the left-hand side of the screen, or scroll down to the middle of the page and click Sign Up.
And Erin and her staff do keep this updated every single month for your viewing, downloading, printing convenience. Erin, give us a quick summary of what are
Well,
these?
this is a brand new newsletter. Brand new. It's only December 2nd.
We'll let it out of the box.
I'm about to. Questions to ask before buying that thing you've always wanted.
Woohoo!
Well, this is probably pretty important during the holiday season. Wouldn't you say?
Do you know what I've always wanted?
There are a lot of things that you've always wanted.
That's right.
What?
We call it lots of things, right?
Yes.
Okay.
Lots of things. What do you think are a couple of questions one might ask themselves before purchasing the thing that you've always wanted?
How long will I use it?
That's a really good question. Do I really need it today?
Well, of course, we're Americans. We need everything today. We need it immediately, right?
That is. Why do I want it?
Because the person who dies with the most toys wins. That's usually what the American thing is, right?
Well, purchase away.
Thank you.
The next article is Demographic Dilemmas. Is America's aging population slowing down the economy?
Good article. That's a very good read as well.
That is a good question. You know, we hear a lot of questions about millennial generations not being as productive potentially as the baby boomers.
I don't understand them.
Those articles or the millennials?
There's like too many generations between baby boomers and millennials at this particular rate. But what's number 3?
It's time for baby boomer RMDs.
Woohoo! We know that.
If you're a baby boomer that hasn't turned 70, you're at the tail end of the baby boomer generation. So I guess we're right in the thick of it. 250,000 people turn 65 every single month in this country. So
Awesome. We're glad they don't all call us.
I'm glad they don't.
We'd be really busy.
That's true. Okay. And the last 2 articles are, what can I learn from looking back on my financial situation in 2017?
Go Trump.
Okay, that's a good point, but I mean, I guess you can look back on your financial situation, but if you didn't set any goals or have any have a game plan in place, maybe looking back, is it going to be as productive as potentially setting those goals for 2018?
Well, no question. I mean, either things happen or you make them happen. And I think when you make them happen, they usually do happen. And at the same time, I think you enjoy things a little bit better. You know, that's what we talk about, is having a game plan. It's like going on a trip.
Right.
You know, you can just jump in the car and start driving or go to the airport and get on a plane. But if you take the time to plan it out,
Right.
know the stops, maybe pick out some places you want to see along the way, have a budget, you can really enjoy things, especially if it starts to rain, you get snowed in, storm, whatever it would be. Having a game plan is good. So I'm sure that's what the article talked a little bit about.
That is, because the second half of the article is, what financial resolution should I consider making as I look ahead to 2018?
Resolve to do it.
That's right.
At least one of them. That's what your grandpa told me. He said, no matter how many resolutions you make, if you keep just one,
You did good?
you did very well. That's right.
Like
Again, we
that.
call it the Coach's Corner. Easy to access. Just go to our website, jblfinancial.com. Click on either that floating icon or go to the bottom of the page. We call it the Coach's Corner newsletter. We're happy to send that out every single month by
Yes.
email. And Erin and her staff do keep the last, again, 6 to 8 months of those archived for your convenience. You know, it's timely.
What's that?
New newsletter and getting ready to close the open enrollment Medicare season, right?
Oh my gosh, we only have 5 days left. December 7th.
Have you been busy?
Just a lot.
How many folks?
We're up to over 120 individuals.
That's awesome. So Erin's already helped 120 folks. So
But we
far
could
this
still help
season.
100 more.
There's a few more days,
There's 5 more days.
and your schedule is busy, but it isn't fully booked.
No.
If folks
We
are-
could have-
But we know that there are questions, and Erin, I know you had an interesting visit with somebody earlier this week, and it really is a pretty good story, isn't it?
It is a
What
great
are you calling it?
I'm calling it How I Paid for My 2 Summer Vacations. Two.
Now, what the heck does that have to do with Medicare?
Everything.
Cool.
So I met with Joe. He's 70 years old, divorced, with 2 kids. One daughter very happily living in Denver, and the other living in North Carolina. So almost on opposite ends of the country.
Two-coaster.
Exactly. 2 plane trips, lots of hotels because he doesn't want to stay with the daughters.
Too long. Can't stay too long.
Overstay is welcome. Doesn't want to do
Or
that.
the parents that get a little antsy.
Well,
It's almost like
you're
getting
always
invaded,
kids,
you know?
You're always kids in your parents' eyes, and some kids don't like that.
Okay.
You know?
But I know that he wanted to see his kids a little bit more.
He
didn't
did, and the grandkids. Really, he wanted to see the grandkids. I really set you up for that. We're just going to move right along.
Oh. You want me to do the I can't wait to have grandkids joke?
No, I don't.
Okay, then we'll pass.
Just gonna
We'll pass on that one right
Well, I
now.
mean, for
Husbands
those
would
of,
be good
for
too.
those of you that are tuned in live right now, you witnessed his face. He made it.
We're not interviewing for husbands today, but we'll do that another show.
Real cute. Anyway, so back to Joe, our 70-year-old friend with 2 beautiful daughters on
Yes.
separate coasts. So right now he's got a Plan F supplement, which is a very popular option. He's paying $215 every month. It's a lot.
Expensive.
It's expensive. And he needs to add a prescription drug plan to that, so that's another $25 a month.
Wow, so in total he's paying what, $240?
$240 a month, $2,800, about $2,900 if we round it up per year.
Automatically.
Automatically.
With
no
or
claim.
without claims, right?
Exactly. So you're turning that over to the insurance company. Sickest year of your life,
Your fa-
healthiest year of your
Your
life.
favorite people.
Hate them all equally.
There you go.
Anyway,
And they never give the money back, do they?
never, not once.
Okay.
So, but the nice thing about Plan F is you don't have referrals. You can see any physician you want in the entire country. You can, you don't have any restrictions in terms of network.
As long as they take Medicare.
As long as they take Medicare, they'll take you. However, we were chatting with Joe about 2017. What happened? So he went to the doctor 3 times. 2 visits to his primary, 3 to a specialist. And he spent about $95 in copays on prescriptions.
Wow.
So, and he had mentioned to me when he was looking at his claims, because he gets that evidence of benefits that everyone receives once you've had a claim, that really the insurance company isn't even paying very much on him because those doctor's visits aren't costly to the insurance company.
And his prescription copays also don't count towards...
They do not count
anything.
towards that Plan F supplement because with Medicare, your medical and your prescription are separate. So the nice thing is that we have the opportunity during open enrollment to discuss Medicare Advantage plans.
And I'll bet you had a good idea for him.
I had a great idea for him. So before Joe came into the office, he sent us his prescriptions. He also sent us a list of all the physicians that he wanted to keep. And I had the opportunity to run the numbers, and it looked like for him that the Coventry Gold Advantage plan was going to be the best option for him. There are several other Medicare Advantage plans available, but
Like United Healthcare.
like United Healthcare,
Like
also
Essence,
Humana, Anthem, they all offer policies. But for Joe's particular case, I was going to recommend the Gold Advantage plan for several reasons. First of all, we can completely cut the premium out.
Zero premium.
Zero premium per
Just
month.
like on TV.
You know what? Sometimes what they say on TV is true.
There you go.
So we can take the $2,900 he was paying every year, completely cut that out.
Cool. So in the theory, he could put that, just stack it up on the table. The money he saved instead of
That
paying
is
for the
right.
insurance company.
He can stack it up on the table. And so what we know about Medicare Advantage plans, all of his physicians were participating in the plan that we suggested to him. So that means he'd have access to every physician that he would like to see. All of his prescriptions were covered, and they were going to be covered at about $2 per fill. So
Get out of here.
that means he had $8 a month to fill his prescriptions. No additional prescription drug plan premium added to that, so we can cut that out as well, which is great. And he gets a lot of extra benefits included in this. So
Especially if he's deaf.
that's right. With the Coventry Gold Advantage plan, they are the only Medicare Advantage plan offering $500 per year for devices. Medicare does not cover that. So under Plan F, you wouldn't have a single dollar towards that. He's automatically going to have $1,000 in his pocket.
And you know, Joe, he was pretty buff. He was
Buff.
a workout warrior.
All right.
He was a workout warrior.
And you know what? He gets a free gym membership with Coventry Gold Advantage. It's called Silver Sneakers. But the cooler thing about that is when he goes to Denver and when he goes to North Carolina, his daughters, they don't have gym equipment in their house. And he's always got to pay to sign up for a week membership or a 2-week membership at a local gym. You can actually just take your Silver Sneakers card anywhere. I said that right, Silver Sneakers card anywhere in the country.
And that's going to save him another $45 a month, or maybe another, basically almost another $500 a year, on top of the $2,900.
We're up to $1,500 in freebies, $2,900 in premium, and if Joe had the exact same year as he had last year, he'd pay nothing to see his primary the first time around because that's covered under Medicare as your annual visit, $5 the second time.
That's great.
$39 to see a specialist, so that means he was going to pay $44 on the year.
Now I get it.
So
You're talking about 2 free trips.
that's right, $2,800 and $1,500. That's almost $5,000 of savings.
Awesome. Now the kids can fight over who Grandpa comes to visit first.
Just think of all the toys and treats, trinkets, all the little baby grandkids are going to get.
Yeah, and you know the neat part is that we're talking about using the same dollars. You know,
Exactly.
looking at a situation, you know, Joe was able to. Aaron, what was cool was you're able to find a plan where he kept his own physicians. He also got some of these extra goodies for, frankly, things he was paying money for,
Right.
like his gym membership. And, you know, it's great. I mean, that's what the beauty of open enrollment is, looking at the plans, seeing the plans, and really be able to make a good choice. One thing I will remind everybody of, and this is something you've shown me at least 30 or 40 times already, this particular open enrollment is, and again, I was going to refer to basically United Healthcare.
Okay.
Right, which is many of the physicians, actually most of the physicians that are in United Healthcare's plan are also in Coventry's plan.
Well, that's right, because Coventry actually has the larger network compared to United Healthcare, because many people forget that Coventry is actually owned by Aetna. They have been owned by them for over 5 years now, but it's really become part of the marketing strategy for Coventry to announce themselves as an Aetna-owned company in the last couple of years. So that means not only do they have a larger local network in the Missouri and Illinois area, but you also have access to their national Aetna network if you were to
And
ever...
they're the biggest carrier national.
Exactly. If you were ever to go out of town. So another great benefit for Joe is that when he goes to North Carolina or he goes to Denver, he has the ability to hook into Aetna's national network if it's available to him. So I'm sure many people remember those Anthem cards, and they had the little suitcase with the PPO box on them. And this is very similar to that. There's just one hook, which is you just got to call Coventry and say, hey, I'm going to be in Denver for the next month. Can you move my network?
It's like your credit card company, right? You got to let them know when you're going out of town.
And so Joe can take his network with him, and he can actually set up primary care doctor. He had an orthopedic surgeon if he wanted to get another orthopedist out of town, just in case, as opposed to having it. Maybe he wants to start taking his extended trips and having extended grandpa time. He wouldn't have to fly back to St. Louis to have access to routine care. You always have access to urgent care and emergency care with these policies. You don't have to call anyone. You just go to the ER or the urgent care. But if you would like to schedule a visit with someone and you're outside of the network, this is the way that you're able to do that. So what this is really showing is that these Medicare Advantage plans are developing the same benefits that the supplements have, but they're not adding any additional cost to you. And a lot of people have the question, well, what about the benefits inside of these Medicare Advantage plans? Do they fluctuate? Yeah, they do fluctuate, however, very minimally. If we look over the last 5 years even, we can see that most of the HMO style plans, like Coventry Gold Advantage, have stayed within the $3,000 out-of-pocket maximum, which means that's the most you can spend in 1 year, except for on prescriptions. So we're seeing stability in the market in terms of the Medicare Advantage benefits. So there's no fear that next year we're going to see a $2,000 jump in the out-of-pocket maximum.
What's cool about open enrollment is that you can, if you want to, change between these Medicare Advantage providers. There's no evidence of insurability. You don't have to start over again. There's no pre-existing conditions. So this year, Coventry is a little bit better.
That's right. So if you were on United,
last year, United was a little bit better. If Essence is better next year, you can flip between these plans. Bottom line is keep your doc, pay less money,
and get the benefits that you want.
Exactly. So again, open enrollment's closing very soon. If you need to, give Erin a call, 314-863-0008, or send her an email, right?
Yes.
Or a Facebook message.
That's right.
Or something, right?
We've got some messages, and I'm just trying to figure out how to technologically view them.
Oh, that's my job.
I can see it.
Oh, here we go.
Yeah.
Number one, Erin, do I have to sign up for Medicare Part D even if we currently are covered by my husband's insurance where he is still working? We will be 65 next May and July and do not take Social Security yet. Okay, this is an excellent question, and we always, this is a weekly question.
Sure.
So, if you are currently working and covered under group health insurance, you do not have to enroll in prescription drug coverage, which would be Medicare Part D. You do not have to enroll in Medicare Part B either.
Right.
Any form of Medicare. You can just enjoy your 65th birthday, May and July.
And call Erin 2 months before you're ready to leave.
Exactly. When you are ready to retire, you'll have a special election into Medicare, which will give you all the same rights and benefits that you have when you turn 65.
Right.
And so it makes sense to wait because the majority of the time, group health insurance really is more affordable than Medicare because it's employer subsidized, it's pre-tax. Medicare is after tax, and you're not going to get any assistance in terms of the premium. But it always makes sense to check in terms of is my group plan as good or better than Medicare benefits that I might have access to or want access to, and what's the premium? Because we do see a lot of large employers that have transitioned to minimal essential health benefits, which means that you're looking at very high deductibles, and potentially higher premiums even. So you may make that transition then, but those are usually rarer cases.
And we do want to remind area employers, those folks who are listening, that we do have a new service that we're promoting, Erin, in that she'll come to your company, visit with your employees, talk about what options they have available for them in terms of making that transition from healthcare, company healthcare, to Medicare, COBRA issues as well. All you need to do is either send her an email or give her a call, right?
That's right.
Fun again, 314-863-0008, or go to our website, jblfinancial.com. That was the only question we're going to hit today.
That was the only question that we received. We do have a few friends listening or watching. I think it's great.
And we love that. And just so for our listeners, our phone lines are always open. 969-KTRS, star KTRS from your cell phones, or 1-888-550-KTRS, right?
That's right.
Good. I think what we're going to do is let's take these 25 minutes after. Let's take the first break of the hour.
Well, before we take our break, because we're
Let's
still
not then.
live, let's discuss, because we're about to wrap up the live portion of the show. I
Okay.
think we need to discuss
Oh, you're right.
the Rockstar of the Week segment.
Exactly. So we ran a new segment. We're calling it the Rockstar of the Week segment, and we need your help.
We do need help, and it's really
A little bit of fun here.
it's going to be a great time. This is kind of the same type of help that I offered you as a child, where you picked out the options and I was allowed to select from what you liked.
I love that. So what we're going to do is we want you to vote,
We have 3 songs selected,
but chosen by Dad.
but exactly.
So generationally, they're correct. Just so you know.
Okay, well that's fair. You did eliminate another fellow baby boomer's thoughts from last week, so I'm just going to reiterate that. But anyways,
I'm over 60, so I can't remember it. But anyways,
so we
why
have
do we have?
3 clips.
Let's. So Tim, start with number 1. One of my faves.
This is Jumpin' Jack Flash.
Better believe it.
I've lived with
Watch
you.
it.
I've lived with you a few years.
Great song. Number 2. Let's do number 2.
Okay.
Band on the Run. That's right. I like this one.
Feels like elevator music.
Let's go to number 3.
Okay. This is a good intro.
This is a good one. Everyone knows that song.
I don't know how you can't go with number 3.
Layla.
If we could get a few votes? I know
Let's
there
get
are a
some
few
votes.
people that are still watching.
We're going to tabulate this. We're going to use
We're gonna use our special tabulator to. If you just want to either post on a Facebook page or in the comments section, 1, 2, or 3. One was Jumpin' Jack Flash.
Rolling Stones.
2 was Band on the Run.
Paul
The
McCartney
Beatles.
and Wings.
3 was Layla.
Eric Clapton.
Eric Clapton. So,
Actually, that might have been Derek and the Dominoes.
no, it was Eric Clapton.
Was that by himself?
I don't. Okay, now you
It could be.
surpassed
I
my
think it could
knowledge.
be. I think it could be Derek and the Dominoes.
Surpassed
Actually.
my
In
baby
either
boomer
case,
music
those are our
knowledge.
3 selections. If you have another one that you'd like to, just keep it to
Throw it in
yourself.
there. Oh. Yeah. Okay.
I like these 3. Okay.
Okay.
But we might entertain them as a closer to this, right? So these are the openers.
Or
and
you
we
know,
make
hey,
it
we
a
might
closer.
add music elsewhere in the show. We're really just pepping things up here
Yeah.
on your Saturday morning. So if you have another maybe a suggestion for the smart choice about your healthcare segment, who knows? Who knows?
That's right.
That's fine.
That would be a lot of fun. You can
Yes.
probably tell behind us. If you can
Santa
see.
is here, guys. Santa.
Santa is actually
And
here
half
at
of St.
Westport
Louis.
Plaza.
Santa and the
And
world.
so are the parents, and they're not looking real happy.
Well, there's quite a line. We're trying to get pictures with Santa, obviously.
Santa's
because
not offering anything good.
Santa's not giving out. Santa's giving out
It's
coal.
not giving out beer to the dad, so forget it. It's just not any good.
You know, I think the next time we do Facebook Live, we should get.
Uh-huh.
You know, if you ever watch like ESPN simulcast, and they've got like Colin Cowherd on there, or like Mike
Sure.
and Mike they had the little bobbleheads that were like of all the sports players. I think we should have like titans of industry bobbleheads. You know, like
Oh, I thought
Jeff
you were gonna have.
Bezos, or like maybe
I thought you were gonna have. We were gonna have our own.
personalized. Well, that would only be 2. We need like a bunch. They usually put like tons of them.
We could actually have one of your mom, but if I hit it, that might be politically incorrect.
Oh, okay. Domestic violence jokes on Saturday morning.
We're having a lot of fun. And you know what, folks? Our phone lines are still open. 969 KTRS. Star KTRS from your cell phones, or 1-888-550 KTRS. If you have questions for Erin or I, just give us a call. We'd love to hear from you. Eric Garybielson, our incredibly young and capable producer, is waiting for your phone call, so give us a call today. I thought that was fun.